Hi, my name is David Malloy. I'm board certified in internal medicine and I practice just outside of San Antonio, Texas. I was initially introduced to the biophotonic scanner about a year and a half ago at a physician conference. And there was a physician there actually demonstrating the scanner. And when I initially saw what he was doing, I was incredibly skeptical. I actually walked up to him and I said, "Gee, what kind of a gimmick do you have here?" And he was very professional and he just invited me to place my hand over the scanner and he took my score. And I thought, well, that's kind of interesting. So I asked him to do it again and it gave the same identical score. And then I made him do it again and he didn't clobber me. And after 3 times, I had the same score. So I thought, well, that's an interesting little device. At least it has precision. But I was still very skeptical about what it did. And so I just pulled up a chair and I watched this physician scan dozens of people as they came through the line. Now, one of the things that jumped out to me immediately was the people that were having the highest scores were the people that were thin, they were non-smokers, they were eating lots of fruits and vegetables. And those people that were scoring really low had a lot of chronic diseases, a lot of pro-inflammatory states like type 2 diabetes and so forth. One lady came through with rheumatoid arthritis and she was hardly detectable. Her score was less than 10,000. So just seeing that as a clinician, it piqued my curiosity. And so I began to do my due diligence. And it took me a long time. And through that process, I learned many things. One is that the scanner is based on Nobel Prize winning technology, and that the company that produces the scanner is one that has an exceptional reputation. So I felt very comfortable with the science. And that allowed me to start looking at the income model, and then I realized that this may be something that we want to implement into our practice. And so we took that leap of faith, and it was really a small one after doing my homework. It was a very positive experience. The very first day that we put the scanner into the practice, we had 20 patients were scanned, 19 chose to go on product, and it just took off from there. So it was a very positive experience from the get-go. And since then, we've had numerous patients go on the LifePak nanotherapy and many of the other products that Pharmanex offers. And one of the enjoyable things has been to watch these people's health improve. Now, we start rescanning patients at about 6 weeks. And patients, when they initially went on the product, asked me, "Am I going to feel better?" And I said, "No, you're not going to feel better." As a doctor, as a scientist, I was very skeptical that anybody would feel better taking a supplement. But when these people came back at that 6-week interval, they were all telling me how much better they felt. Initially, I just thought, well, it's placebo, it's placebo. And then I started asking them, well, when did you start feeling better? And every one of them said 2 to 3 weeks. We asked that question to over 100 patients. And there was only one that said they felt better the next day, so we knew that was placebo. And that kind of made sense. If you have a nutritional deficiency, then it's going to take a few weeks before your body levels come up to an optimum level. So that was a very strong validation point. And being on the product myself, I also began to experience that as well. So it was a very intriguing thing from a clinician's perspective. We have a society that is obese and unfortunately malnourished, and so this program is a way to help our patients take a very proactive step towards prevention, but also to help them feel better. From a more traditional internal medicine standpoint, we've seen people's HDLs improve. We've seen some patients require less antihypertensive medications, and we've seen some patients drop their A1Cs from 0.5 to 1.0 points. And so it's been very effective in that regard. So there's a lot of positives to say about this program. And one of my biggest concerns was time. I'm extremely busy, probably like yourself, and we have an awful lot going on in our practice. And I was concerned that this program might disrupt patient flow. And I was afraid that it might blow out my staff. And what I found was quite the contrary. It was very easy to implement the program with a staff incentive program that we put in place. The staff actually embraced it in a very positive way. They were very enthusiastic. And so initially we started scanning on just Fridays, and The next Monday I came in and my nurse was all bright-eyed and bushy-tailed, and she said, "Hey, Dr. Malloy, we've got the scanner up, it's ready to go. If you want to start scanning people, let's do it." So they were very excited, and they've been on board ever since. So the time was my main concern. It turned out to just be absolutely nothing. It was exactly the opposite. And the truth of the matter is this program has created enough residual financial cash flow into the practice that it's allowed me to have more time as a physician. I was working 6-7 days a week. I've been able to cut that back to about 4. I'm actually able to spend more time with my patients. I'm very passionate about preventive care. It takes time to do good prevention and to do good lifestyle counseling, and so the scanner program has actually helped me develop more time. The income is very much what they say it is. It's no frills. There's no hidden agendas here. This company is very straightforward, and the income that I'm experiencing right now is beginning to rival my physician income. So I would just encourage anybody who is interested in developing residual income streams into their practice. This is something that's very nice because it exists outside of the third-party payer system. You know, one of the things that had a very profound effect on my education and my due diligence was actually coming out to Provo and seeing the Healthcare Professional Forum, touring the facilities, touring the labs. You know, as you look at this video, think of, trust but verify yourself. It's important to have that personal experience. There really is no substitute for coming out, seeing, touching, meeting some of these scientists and some of the other physicians that are incorporating this program into their practice. The big thing for me, number one, was I did not want to come across as a snake oil salesman. I wanted to offer a pharmaceutical grade product to my patients, and it needed to be safe. And that is one of the things that I was able to learn on my trip out to Provo and visiting the labs and visiting the headquarters, but also seeing other physicians implementing the program and talking to them about their experience. We don't sell in our clinics, we just simply provide an opportunity for our patients to shop. And 70% of our patients are already on supplements. I think it's very important that physicians offer them some guidance because there's just simply so much noise and false claims in this whole market. So I think it's a very important thing to come here and experience it yourself. I think it's important to bring the just an appropriate, healthy skepticism, but an open mind. Just evaluate this like you would anything else in medicine. Understand that we finally have a way to offer our patients an objective measurement of nutrition. If we look at somebody's health, it really consists of a table, and that table has 4 legs. And that first leg is exercise, the second one is emotional well-being, third one adequate rest, and the fourth one is nutrition. Historically, we can really get to those first 3 legs easily, but we've never had a way to measure objectively and with good science that 4th leg. This biophotonic scanner is finally a way for us to do that. So it's really something that I think is critical to our patients' health, and I think all physicians should embrace this technology. The teamwork and the support as far as implementing this program and carrying it out has been superb. The professionals that work with PharmNX are top-notch. The amount of support that you will get will be unparalleled. You will not be doing this by yourself. You'll have a team there with you to train you and to train your staff and to hold your hand through this process. So it should not be an intimidating thought at all.